Good evening, everyone.
Good evening.
My name is Brian Maddox. I'm the proud principal of Thomas McCain High School in the Red Clay Consolidated School District. And on behalf of our National Honor Society, co-sponsoring this event with the Human Ecology Foundation, I'd like to welcome you this evening. Tonight's topic of addiction is such an important topic. It's impacting young lives and old lives across our country. And it's an epidemic that we all are being touched by, and it's important for us to come together as a community to find some answers and solutions. At this time, it is my distinct honor to introduce our co-host this evening, the founder of the Human Ecology Foundation, Mr. Mike Carney.
Thank you, ladies and gentlemen. I just want to let you know that we are streaming live to Servium Academy in Wilmington. They're doing a service project also, and it's on healthy living and healthy eating from their garden. And I just want to welcome them as well. They should be following us as we go along. A little bit about human ecology. The foundation works with students who do community service, research, and then document that service, as so many of the kids from Newark Charter have done, Mount Pleasant, Servium, and a great effort tonight by the Honor Society at McCain. So we appreciate that effort. For projects that show merit, we give small grants and scholarships for those who have achieved that level. I also want to introduce and welcome our many sponsors. Recovery Centers of America, Christiana Care, DEAC Medical Solutions, Delaware Council on Gambling Problems, Small Wonder, Narcotics Anonymous, our good friends at For Youth Productions, Progressive Systems Inc., Morris James, Volunteer Delaware, and Blue Hen Parking Partners. So we have 4 or 5 different schools doing human ecology projects right now, and we'll have we'll elect and figure out exactly who's going to get grants and scholarships in a couple weeks, and we're very excited to see how that works out. But without any further ado, I'd like to introduce our moderator for tonight, Don Tollefson.
Thank you very much.
Don was fighting traffic all the way down, and we're glad you made it.
I am delighted that I made it. Hello, everybody. My name is Don Tollefson, and I am honored to be your moderator tonight. I had quite a journey. I left Philadelphia. I live in Philadelphia at 3:30. I've been traveling back and forth to Wilmington for 40-plus years. I've never had it take me 2.5 hours, but I made it, and that's all that counts. But 95 and the Blue Route were both closed down due to a propane tanker that overturned, and hopefully no one was hurt. I'm so honored to be here tonight because we have a great opportunity tonight to do exactly what the logo of this program suggests, and that is learn about being lifesavers, learn about how we can save lives in the midst of one of the biggest public health tragedies. It's really gone beyond, in my estimation, a crisis or an epidemic. It's a public health tragedy which has affected this country in so many various ways, but all of them basically negative. And before I introduce a distinguished panel, I think that you will find tonight, and I appreciate all of you coming out, there's a lot of things to do, but to be here tonight gives you an opportunity to be part of something that I think will be very informative. I think it'll be very compelling, but it'll ultimately be very, very wonderful, because we're going to look not just at the problem that confronts us, but this is a solution-oriented gathering. We're going to talk about what are the solutions, what are the things we as individual Americans, whatever our roles may be, whether as the 7 of us up here, whether you're in the recovery profession in one way or another, or you're out in the audience and you're a civilian of whatever age and whatever background and whatever reason for being here, you have an opportunity you have an opportunity tonight to learn some things that I think can and hopefully will stay with you the rest of your lives. And they will stay with you in a way that you know you can make a difference. You can make a difference in, if no more than one other person's life, you can make a difference which may in fact be life-saving. Some of you know my background was that of a sportscaster for ABC and ESPN, and also ESPN Radio, and also Fox Television and the NFL on Fox. And I spent a lot of my time with statistics and all. And tonight we're going to hear some statistics which I think will deepen the serious meaning of what we're doing. But before I introduce our panelists momentarily, I want to tell you one statistic that I talk about almost every day wherever I go, whether I'm speaking to schools or community organizations, speaking in rehabs or meetings of Alcoholics Anonymous and Narcotics Anonymous. Wherever I'm speaking, for the last couple of months, I've mentioned that the Centers for Disease Control has reported that for the first time in many, many, many years, life expectancy in the United States of America, the greatest country in the history of civilization, in my estimation, the most medically talented country in the history of civilization, the most involved politically and community-wise country in the history of civilization. For the first time in many decades, life expectancy has dropped 2 years in a row for one reason and one reason only, and that is overdose deaths. Overdose deaths have taken down the entire actuarial tables to the point where we don't have as high a life expectancy as we had 2 years ago. And that, to me, really, really underscores why these folks and you folks and myself are all here tonight, because that is unacceptable. That's really unacceptable, and it's preventable, and it's changeable. And tonight we can start that process, whatever your reason for being here is, in a big, big way. So now it's my honor to introduce a panel that, let me tell you this, they have different credentials, they come from slightly different backgrounds, although very dedicated to public service, community service, and working to help people in their professional and personal lives. But they all share a passion. They all share a passion for spreading the word and giving you the toolkit and really, really explaining how you can prevent the next tragic statistic from occurring. So I'm going to ask each of them to give me a hand in the air when I introduce them in the order they're in your program, so you can see. Rebecca King. Rebecca is right next to me, and she is the Director of Nursing, the Division of Public Health, Delaware Health and Social Services. Rebecca, thank you so much for joining us. This is really great. Then to, no, you know, that's polite golf applause. I'm a football guy. Here at the high school where Randy White, even though he was a cowboy, he was a great human being in addition to being a great football player. Let's have a nice football round of applause for Rebecca King. There we go, there we go. To her left, the wonderful Domenica Personti. Did I come close? Close? Close, okay. She is the CEO of Bracebridge Hall at the Recovery Centers of America, and we thank RCA for helping sponsor tonight. We thank you for your presence, and I'm in the midst, as I told you before I sat down, of a 10-week training with the FRAT group, the First Responders Addiction Treatment, at their new facility in Devon, and they are really marvelous in the way they share information. So thank you for being here personally and on behalf of the great RCA. Then we have Elizabeth Walker Romero. There you are, there, I met you at the beginning. She's the Director of the Delaware Division of Substance Abuse and Mental Health. Thank you, Elizabeth. Great to have you here. Then we have Mark Alston, Assistant Chief of the Newcastle County Paramedics. Thank you, Mark. Great to have you with us. We have Christine DePaulo, who may have been playing football recently. She is from the Department of Adolescent Medicine. And then finally, at the end down here is Mike Stafford, a treatment graduate of Bracebridge Hall. And Mike, for all of us in recovery, and I'm in recovery 1,654 days, God saved my life, and my little daughter saved my life, but the professionals up here saved my life too. I'm just so indebted to those who are in recovery who will come talk about it, you know, and really work to help share the secrets that saved them. So we have a great panel. Let me just tell you how the format is going to work. We're going to spend the first half hour answering some questions which we pulled together over a period of a couple of weeks. My friend Mike, who did such an amazing job of putting this together, asked each of us to kind of list what we thought might be the most useful questions for this audience on this night and all. And we got it culled down to 12 questions. So what I'm going to basically do is just go off the order in which I introduced everybody. So Rebecca, you're up first, if you don't mind. And the question that we wanted to start with is just how widespread, in particular, is the heroin epidemic in Delaware? We know the stats, tragically, 345 in 2017. How many have overdosed in this year? And how many just say over the past week, if you know?
Hi. Well, really, I want to start with the most important statistic is you, and you not becoming a statistic. So I do want to preface what I'm going to say for that. So that's really what's most important. We have had 74 deaths in Delaware this year so far, and weekend before last was a really tragic weekend. We had 36 overdoses that resulted, that was in 3 days, so 9 a day figure, and that resulted in 6 deaths. So this really is an epidemic proportion. It's this way across the country. You know, Delaware ranks up there pretty high as well. But this is a really serious problem everywhere, and I'm really glad you all came out tonight to hear about it. But it's here in our state. You can't ignore it. I'm also the mother of a daughter in long-term recovery, and you know, the 3 scariest words I ever said was "not my child" or "not, you know, not me. This isn't me." And it happened to me and to my family, and it can happen to you. So I just don't want you to become a statistic. That's what's most important.
If you could just speak to gatherings of people in your profession, because I've had an opportunity to be at some public health meetings, and I have yet to be at any one or heard of anyone where the opioid epidemic is not topic number one. Is that in fact the consensus opinion?
Right now it is the #1 public health epidemic.
Yeah, and what sustains the sense of optimism that those of us in the recovery profession need to have? How do you sustain optimism when you deal with situations like the weekend you just described?
Well, I can, from my personal opinion, is to just say to never give up on hope. I never gave up on my daughter. We always treated her disease, because addiction is a disease, with love and compassion and urgency, and trying to get her the best help possible, and just never giving up, even when she would have periods of relapse. Just still being there and helping to support her, and also having a community of recovery is really important as well. You know, just hitting home all those messages all the time and never ever giving up. But you can't give up hope, because you just can't. We all have to hang on. We're, you know, lifesavers. Grab hold of that raft. Hold on.
It's so well spoken and so necessary, and I basically, I think frequently when I try to avoid ever giving up hope of a guy I knew just a little bit from interviewing him, but Jimmy V. You know, who right before he passed from cancer, obviously another tragic medical situation, you know, just never give up. And I give praise to ESPN for always keeping his memory alive, and they replay never give up, never give up. Thank you. That is wonderful. Dominica, now pronounce it for me so I can try to get it right. Dominica. Oh, well then now I'm better, okay? Okay, yeah, in many other ways, kind of like a Tollefson situation. What makes for an effective intervention, in your estimation, being in the rehab profession? What makes for an effective intervention with a person struggling with addiction?
So You know, Becky talked a little bit about compassion and you know, love, and I think also realism, right? So when a lot of people think about intervention, they think of it in like a punitive manner, right? So we're going to get everybody in a room, and we're all going to say, these are all the things that you're doing, and commit to treatment, or we're going to kick you out and take your keys, and you know, all those things, right? Because that's tough love. And 5 years ago, that was what everybody thought saved people's lives. So what we know now from research and from, you know, years of substance abuse treatment and in the recovery field is that, you know, two things are very common when you have somebody who is a chronic relapser or someone who's resistant to treatment, and it's compassion and connection, right? It's that those individuals who seem to revolve through doors normally have a lack of connection to their community, to their family, to the recovery community, you know, and also a lack of compassion, which often isn't real. Some people, you know, feel like, you know, they burn a lot of bridges. There's shame in addiction, right? It's hard for people to say, unfortunately, I messed up again, right? I relapsed again. Those are difficult conversations for individuals who suffer from this disease to have with their loved ones, especially after they have any type of period of you know, sobriety. So, you know, when we do interventions, and those of us that work in the field do a lot of interventions. You know, some of them are 5 minutes and some of them are 7 days long, right? It's reassuring an individual that there is hope and that there's life on this side that can be as equally fulfilling as everything that drug or those drugs masked for them, because it's all an escape, right? That's what people want. They want to not deal with the things that are happening. You know, so it's showing people that there is life after recovery, you know, after sobriety, during recovery, during sobriety, and that's a real thing, and that their life doesn't become boring. A lot of people think that, right? Or how will I cope with A, B, C, D, because for 20 years all I've done is use to mask that. So it's kind of taking, you know, an inventory of their fantasy versus their reality, right? And this is what you think that this might be, but let's show you, let's hold your hand and show you what it's really going to look like, right? And let's love you through it. You know, let's forgive you when you make mistakes. Let's be there for you, you know, and let's show support in droves, in numbers, because if we wrap around individuals, the success rates that we see with people who have 18 months and longer are people that'll tell you what worked for them was wraparound services. You know, an AANA sponsors a solid clinical aftercare program, a full continuum of care. And all of that starts with an intervention. It starts with a I need help or you need help, you know, one of the two. And really where it should start is we need help, because the whole unit has to engage in treatment, and it doesn't always have to be family, right? But that whole support system has to be committed to treatment and recovery for an individual to get well within that unit.
Great stuff. I'm going to take our third question and send it down the row here to Mike Stafford. Michael, what are the best strategies for countering a person's denial of substance abuse? And denial is the common denominator of all of us who have ever faced addiction. What are the best strategies for overcoming denial?
Personally, for me, it was a constant reminder. But with compassion, like was said, when somebody was being stern and telling me, you know, if you do this, I'm not going to be a part of your life. Or
Hold the mic up just a little
if
closer.
you
There
do
we
this,
go.
I'm not going to be a part of your life. Or if, you know, I find out you're using again, you can't come home. That in itself shut me down. You know, it made me not realize, it made me think that they didn't care no more. And with them not caring in turn, I didn't care no more. I lost sight on myself. So the compassion part of it, you know, understanding that I relapsed, I'm using, whatever the case may be, and helping me figure out how to get back to where I need to be. Because I didn't want to believe I was an addict. I wanted to believe that I could use and stop when I wanted to.
Exactly.
And the reality was, once I started, there was no stopping. Yeah. For me, it either ended, like the saying goes, you know, jails, institutions, and death. I either ended up in jail for a long time, in rehab or treatment or a hospital, or, you know, last time was face down in an abandoned parking lot. Yeah. So that for me is what it took. It took for somebody to constantly be compassionate and understand and remind me with compassion.
Thank you, man.
Mike. We're proud of you.
Yeah, absolutely. Very, very proud. I'm going to move over to Chief Mark. And how does Narcan work? Could you give us a description of the process of the life-saving Narcan that we're now talking about so much in our society, thankfully?
Well, to make it easy to understand, essentially there's with chemoreceptors, there's chemicals, whether you're taking aspirin or you're breathing oxygen, and they have a bonding. What happens is opiates, they have an affinity. They just jump all over that, and that's what disturbs or ends the respiratory communication where people stop breathing first. So what Narcan does is actually just forces that off of those chemoreceptors. And we paramedics have been carrying this for over 40 years, right? So why is there suddenly the interest to talk about it? Obviously, we see an increase in our run volume, and now we have police officers, and we have establishments, whether it's a school or whether it's some type of an area where more people live, where they have it available to them. Just to give you, this is about solutions, not about statistics,
Sure.
but to give you an idea, in the almost 30 years that I've been doing this, our run volume, the amount of calls that we get totally, usually go up about 2% a year. And if it's creeping toward 3%, that's a big deal. So since last year, from 2016 to 2017, look at the entire year, our run volume because of the opiate overdoses increased 10%. 10%.
Wow.
Okay. Don, you mentioned how this trickles down. CDC is telling us over the next 3 to 5 years that what's happening now is a cakewalk. We're hearing from the CDC that because of this, child abuse is up 26% in our nation. There's so many things that trickle down. And I'm speaking as the Assistant Chief of the paramedics here. Other people are sharing their personal story. I can assure you that that has affected me too. I have a son that's an Air Force veteran that went to this high school, and right now he's in recovery and went through RCA and a lot of other places, and we're raising grandchildren and things like that, but it affects us. Narcan in the hands of police officers and first responders such as EMTs on your ambulances, in addition to the advanced life support, are probably accounting for anywhere from about a third of the administrations. I can tell you that from 2017 to this time, now in 2018 comparatively, we're up about 40% on the administrations, and thank goodness that funding is being made available from other sources. I know in Newcastle County, Green Hill Pharmacy has made it available to first responders. So getting that in the hands is a reactive way. There's a lot of prevention, but we also have a Heroes Help through Newcastle County Police that allows a way out, a kind of a white flag surrender and get help. We're partnering with University of Baltimore and through Christiana Care with their Project Engage, and not just reaching out to those that are in the hospital, but the follow-up. So Narcan's the start. That's the reactive end of it, and then we go from there.
Thank you very much, Chief. I'm going to move on to Christine. Christine, should teens be screened for drug and alcohol use, in your opinion, at their pediatrician's offices?
Absolutely. I just wanted to comment on a couple of things that were said in the panel prior to answering that question. So Narcan is very important, and I'll say in the hospital, since September, we've had 5 admissions for accidental overdoses in kids 15 to 19. And in 3 of those cases, the parents had Narcan at home and were able to administer that. So, I mean, that speaks volumes. And I know that there was a bill passed recently. I don't know what bill it was, but it is available. And I don't know if you said it is available over the counter in the pharmacy for about $40. Is that correct? I think that's. But I'm here as a pediatric nurse practitioner, and I have to say that addiction is a pediatric disease. I mean, if you ask anybody that's in the thick of their addiction or in recovery, they will say that they started to use when they were teenagers. So we have to really, really pay attention to that. I mean, I see kids every single day, and I ask them, I screen them for drug and alcohol use. And I would say 70% of my kids use marijuana to relax, to do their homework. They're self-medicating. And that's where it starts. And so to answer the question, should we be screening? Absolutely. And parents should be asking their pediatricians to screen, and they should be giving the pediatricians an opportunity to do that by leaving the room. Because if you are in the room, most often when you go to the pediatrician's office with your child, you stay in the room the whole time, correct? Yeah. Are they, and you know they're not asking those questions. So you really have to take that opportunity to say, hey, I'm going to leave leave for a few minutes, and even if you can talk to the provider or whomever is seeing your child and say, can you screen for this? Because more often than not, kids are using marijuana on a regular basis, and we are seeing this in the hospitals. So my role, and we actually are applying for a grant to actually start going into the community, and we've already been doing this, is educating the community, the pediatricians in the area on how to screen, and we have an effective screening tool that has been validated through research for kids 12 to 17. And this is what we're really encouraging our pediatricians to use.
Thank you. That was great. Elizabeth, you're next, so you get the mic. Obviously, there is a relationship between addiction and mental health. That's very, very self-evident. But could you speak to how you feel the services that treat addiction as a mental health issue and overall mental health issues, how are they best coordinated?
It's a really good question, and I think I'd like to add to a couple things that were said on the panel, and especially as you all think about a friend or a loved one that you have in your life.
Rebecca, hold the mic up. There we go.
A friend or a loved one in
Thanks.
your life that might be in recovery, or you're seeing in a downward spiral, or you're saying, oh, I know they're using, how many times have you seen someone on Instagram post like, oh, gonna do some acid, and this is what I'm gonna do when I go to my party, and they'll put that up, and unfortunately I have teenagers, so I've seen these Instagram posts myself. And I think the thing to think about is recovery and helping people with compassion recognize that they themselves are the ones that have to make that decision about whether or not they have a problem or not. And so being compassionate is really critical, and at the same time understand that they also own this for themselves. And so you have a role as a caregiver and a person who, or a friend, and at the same time they have a sense of responsibility for themselves. So you are there to be supportive, to make sure that if they need help, they're there to have the help they need. And at the same time, you will not be the one to drag them in with handcuffs into a recovery or a treatment program and say, fix yourself, because that has to be from that person. So for all of you all out in the high school on the other end, just understand that interventions and staging an intervention, while you may want to do it, may not have the exact outcome that you wanted. So do your best, be compassionate, be loving, and then recognize that you've done as much as you can, and then you've got to let them take the ball for themselves and continue going. So I just wanted to add that, because the whole process is not a one-shot process, and I think that sometimes people get that in their head. And I'm sure you've heard it before. Mike at the end said, I relapsed again. And sometimes even SAMHSA and the experts will tell you, sometimes it's 5 to 7 times before someone actually is able to maintain their recovery. So again, really being patient, really understanding and understand it is a process and it's a lifelong chronic condition. So it's not like they're an addict, they're not awful, they just have a lifelong disease, and this is part of their process to get there. So as it relates to integrating mental health and thinking about substance use, is sometimes people self-medicating for a variety of reasons. Sometimes they've had very bad trauma in their life, and this is one of their ways in which to manage it. Sometimes they got prescribed something and then they got addicted to it. So there's many reasons people become addicted to medication. And unfortunately, with opioids, it definitely changes your brain, the way it functions, and so you definitely need that extra support in order to recover. But I would say is, as you look at these opportunities, it's really having the counseling support as well as your treatment. So understand that going to detox and then getting out, or going to inpatient rehab and getting out, doesn't mean that that journey ends there. It means that you have to continue that work to understand why you might have been using, what are those opportunities, and then working with your family or those you love to make sure that you don't get triggered to start using again. Or if you're a family member, working in mental health and support and understanding, well, am I a trigger for them as well? So if I'm deciding, oh, well, I'm just gonna have a drink while you do this, maybe that might not be the most loving thing someone could do as a friend or as a family member. So, so thinking about it together is being supportive to their mental health is sort of a lifelong process, and at the same time, supporting and looking at your own behaviors around them is important too.
Thank you. That is great. Dominica, next question's coming to you. I have as some people know, I have a street ministry in Kensington where we lost 35 people in 5 days. It's really the epicenter in this area, although there are some stories from West Virginia that are just similarly statistically tragic and all. But I just started working a month ago with a street addict who's 24 and has been in rehab 27 times. Now that's almost hard to believe. What's really hard to believe is that he's still alive, thank God and all. But how do we overcome the belief in some circles that, you know, relapse is going to happen, you know, that there's an inevitability to relapse? How do we fight that?
So that's a loaded question.
Yeah, it's a tough one.
So, well, and then there's all this other information that came. So I'm going to try and answer that along with adding to some other things.
Great.
So one thing, if you all leave here and hear nothing else I say, please hear me when I say, by any means necessary. So when I'm listening to people talk, right, my opinions differ a little bit from some of this information. So, you know, by any means necessary, that means we are all responsible. I am my brother's keeper, and I'm responsible regardless. And while an individual might not own their addiction, there's this thing in treatment that we call act as if, right? And if you act as if long enough, eventually you're going to get it, right? So you may have to take somebody kicking and screaming into treatment, because by the time they leave, they're going to express their gratitude, they're going to tell you that they love you, and they might get it that time. It's by any means necessary, and that means interventions, loving them through it, compassion, connection, all of it. It also means, I'm going to share a little bit of information, it also means when someone leaves treatment because they don't want to be there, right, goes to Kensington and overdoses, when he said he was face down on the concrete, the person with him called me at 11 o'clock at night and said he can't breathe. And I'm calling 911 on one phone, and I'm talking to him on the other phone, and how many times had you been in treatment prior to that? Mike was that guy. Mike was that guy that came in, and everyone said, oh, he's going to be so hard to treat, right? He had all these treatment episodes and all this stuff, and you know what worked for him? If you ask him right now in this moment, what worked for him? We brought him in kicking and screaming. He didn't want to be there. We brought him back, and we said, you know what? We love you regardless. And he acted a fool, and he did everything to break the rules he could in RCA. And what did we say? We love you still. We love you still. And that goes against some ethical things, right? Because people will tell you, hey, you're not supposed to love people. I don't believe that either. Because I believe that's how people get well. We love people through things. So sorry, I love you. We'll hug when the camera's, you know, whatever. But that's what, right? That's what people need. They need to know that they're loved. Whether I knew you for a minute or not, my responsibility as an individual is to save his life and anybody else's life that's out there. And that is by any means necessary, no matter what we have to do. Right? And so the only other one thing I want to say, I think it's really important. In the state of Delaware, an individual can access treatment at 14 years of age by law, with or without parental consent. So those of you that are here right now, when we talk about kids using, if you know someone who's using, don't be quiet about it. Don't be worried about being a snitch. Don't worry that they're going to be upset with you. Because when we're quiet and when we follow all the rules and we, you know, people die, right? People die. So there's no diplomacy in this. Right? If we're quiet, people die. So take them kicking and screaming, do whatever you have to do, love them through it, and we'll help people get well. That's the way people get well.
Rebecca, can you talk? Yeah, great stuff. Feel free to applaud. Can you talk a little bit about the challenge of insurance? In navigating treatment, insurance is so complicated, and sometimes, I've been in rehab, I work in rehabs, I see people who thought they'd be there for 28 and their insurance is taken away at 7, and, how do people who may need to get into treatment or help someone get into treatment, how do they look at insurance and the challenge therein?
Well, I'm going to answer half of this question, and then I'm going to turn it either over to Dominica or Elizabeth.
Okay.
From my personal standpoint, when my daughter was bouncing in and out of different systems, her very first time, she got 11 days in a rehab facility with 6 outpatient days. And I can just say that that was not enough at all. And subsequent times when she was admitted and readmitted because she too relapsed, it took her, my daughter is 5.5 years, by the way, now in recovery and is doing fantastic. But, she did bounce, thank you. She bounced in and out, and our biggest challenge was the insurance issue, not paying for her to be there long enough for her brain to heal. And start to be able to think clearly again and make good decisions and good judgments that would lead her on a path of recovery. But I don't know if you want to.
Yeah, she's right there.
So the squeaky wheel gets the oil, right? So like if you have a loved one that's in treatment and you find out they get 7 days, which is usually what happens, call everybody and their brother under the sun. Your insurance commissioner, put his number in your back pocket. If you have an individual that you love in treatment, put the insurance commissioner's number in your back pocket. The first thing they're going to do is say 7 to 10 days. And at 7 to 10 days, they're going to say, oh, there's no medical necessity. Remember that, because that's what they say, no medical necessity. And then after that, if they get 3 or 4 more days, you might get another 5, usually around 21. If you have really good insurance, that'll probably cost you $2,500 out of pocket because the deductibles, right? Call your insurance commissioners. Call everybody that you know. The squeaky wheel gets the oil. And the other thing to remember is places like ours, there's sometimes this thought, we have this big behemoth. I have 7 inpatient programs, all around here. We do scholarships. So if you don't get what you need with the 7 days of detox or whatever, pick up the phone and start calling any treatment provider in your area, especially those that are in the areas where you live and reside. Pick up the phone and say, listen, I'm from your community. My son is in your community. We need help. We've gone here, 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 and here. Call the governor's office. Call the lieutenant governor. Call DHSS. Call everybody until somebody is willing to give you a shot. Call me. I'll provide you can give my contact. I'm at Bracebridge Hall. We do 15% of our beds are scholarship beds for people who can't afford them. They have to commit to 30 days because we believe in a 30-day model. We don't think that people get well under 30 days, just like it was already stated. 5 to 7 days of detox, that's not helpful, right? You need 50, your post-acute withdrawal, you have 4 to 6 weeks. So call everybody, right? Don't ever underestimate the power of your voice because you are your loved one's advocate. And again, it's by any means necessary. Write letters. Social media is the best way to get to companies like ours. Right? Any treatment provider, let me tell you, I check my reviews every morning. Somebody puts a complaint, I know it. I know it by 7:15, and I'm calling that person because I want to save lives, right? I'm calling them and saying, what did we do? What can we do? And that'll force some additional days because we need that. The ideal time frame is 21 to 45, and that's just the start. That's just to get them clear enough to start the next phase, which is, partial and then IOP and all those other things.
So I'd add to that is that at DSAM and also in the division for the kids department, if you have a friend that is under 18 or someone that's over 18, clearly if you go to the helpushere.org, which is Help Us Here Delaware, the mobile crisis number is on the website. Call that number. We actually will come to you. We will do an assessment, and once we enter you in the system, if you can't pay for it, we cover it at DSAM or the kids department covers it. So again, we want to make sure that you get help, so feel free to call Mobile Crisis for any psychiatric or substance use crisis and get your friends the help they need.
Yeah, my clean date was October 12th, 2013, and I got a scholarship. I went to a marvelous rehab called Marworth, which is run by the big Geisinger health system and all, and a scholarship saved my life. We have such a brilliant panel. A round of applause right now, because they've already answered the next 3 questions, but I'll just go over them to follow the format, and then I'll get to the audience. I got you, Michael. I got you, brother. He's a producer, but I don't have an earpiece tonight with him to talk into. Chief, if someone calls 911 to report an overdose, will they be arrested?
That's a great question, and if you don't know, the answer is no, they will not. The Good Samaritan laws extend way beyond that, and that really is a lifesaver. I can't tell you how my experience as a paramedic, when I was on the street, when I was really doing it, people would get everything cleaned up to leave you a corpse or somebody not breathing. And I'll tell you, as a personal experience, I had a cousin in South Philadelphia, and he was out with his mother. He was 40 years old, came back home. He had to work the next morning at 11 p.m. He said, "Mom, I'm going out for a little bit." He said, "You have to work in the morning." At midnight, Philadelphia police knocked on the door. Where he had gone to have some heroin around the corner, they had moved him down to a stoop down at the end of the street. Bikes passing on Avenue, figured somebody would see him, and they didn't. So that's what happens. So call. You won't pay the price for it. It's a
Absolutely. Should I carry Narcan? We just heard anecdotal evidence of the family having it at home, and it's not that expensive when you consider it can save a life, something for which no price can be placed upon and all. This is a tough situation. If someone is treated and taken to the hospital for an overdose, can they check themselves out on their own? Against medical advice, that happens tragically in rehab all the time. But is there anything that unless they're is it a 302 in Delaware? I don't know what it is. In Pennsylvania, when you're involuntarily, you're voluntarily committed. But can people who are treated for an overdose check themselves out of a hospital? Yeah, that's what I thought they could. Yeah.
They can even, and I'm sure that unfortunately the EMS have seen this, where they'll refuse care from that site. So, I mean, I think that's the fortunate part of stigma, and just feeling like I've done something, I feel awful about it, I'm a bad person, but that's not. It's okay. You have an overdose, that's an opportunity to get the help you need. So let them take you to the ED, let them take you to an addiction treatment program, let them take care of you and let them help you. So that's really the most important part, is you should never feel ashamed for asking for help.
We're going to go rapid fire and then get to the audience, because I got my wrap up on the first part. But I'm going to start with Mike. 30 seconds for each one of you. What sustains a successful recovery?
Okay, so for me, my recovery is based on my network, and that's the people that I have that support me. Because unfortunately, I made bad decisions for so long that for me to make a decision on my own, I just don't trust myself. Now I'm coming to a point where I'm starting to make decisions. I got a little bit of time under my belt, and I'm starting to be able to make decisions on my own. But I still, if I'm having one of them days or a thought crosses my mind that I know shouldn't be crossing my mind, I pick the phone up and talk to people. Because, actually my sponsor's in the audience, and his biggest thing is, call somebody, say it out loud. See how stupid it sounds when you say it to somebody, because, when you decide in your head, I'm going to go use again, okay, you can convince yourself that anything's okay. But when you call somebody else and you hear it come out of your mouth to somebody else, then you realize that this is a stupid decision. So that's my biggest thing.
Thanks, Mike.
So support systems, absolutely, probably the number one thing. Ongoing therapy and treatment, because our outpatient programs are the pillar of what helps keep people well. Wellness programs, hope, right? I can sustain this, I can do it. As long as we're telling people that they can do it and we're proving them they can do it, setting goals. And I'm a firm believer in anything visual. So vision boards, we do vision boards and things like that with our patients so that they can take it home. And the other thing is playing those tapes out. Goes back to kind of what he said. Like, yeah, I might use today and I might feel good right in this moment, but if I end up doing it, you know, what's it look like? Oh, wait, jail. Yeah, let's not do that. That might not be the best thing, so.
I already touched on love and compassion, and I certainly agree with what they had to say. So I'm going to use my 30 seconds here and put on my public health hat. And I just want to, again, stress the website that Elizabeth mentioned, Help Us Here DE. Please go to this website, take a look. It's got lots of resources there. You can learn, you know, a lot of things about addiction, because the thing I didn't know I didn't really know what was going on, so I think awareness and education is key. And again, to stress, everyone needs to carry naloxone or have access to naloxone. You can find out how to get that on the Help Us Here website as well. And to all the kids here tonight, if you don't do anything, please go away knowing that you can call 911 and nothing will happen to you if you call because someone has drank too much or maybe experimented with some drugs or tried something. Because you know you want to save their life, and that's so important. So just always remember to do that. Call 911. Nothing will happen to you. No questions will be asked, and you'll save a life. You'll be a hero. Thank you.
As a recovering addict, I reflect on what Mike said and all. But what has helped me tremendously is I have my photo from detox. I have my photograph from what I looked like in October 2013. And my 8-year-old daughter, thankfully, I get to see a lot of her, so I don't put it up on the bathroom mirror as I would otherwise, but it's in an envelope. I keep it in a drawer. And whenever I think about making a stupid decision, all I do, and he has one right there, Michael, is just basically say, I don't want to ever go back to looking like that and all, ever. Chief, successful recovery, what's the key? Successful recovery, what's the key? I'm just going to get the last three of you, Christine and Elizabeth as well, and then we'll go to this awesome audience, okay?
Is persistence.
Yeah.
And from an EMS, from a 911 perspective, is we are never, ever judgmental, okay? There's 911, there's not a 912. We are it. We are the ones who can intervene clinically. We are the ones who also could be the advocate when we recognize what's going on, making sure that we make the right contacts for them at the hospital, whether it's something like Christiana Care has, Project Engaged, social workers, whatever, and is to treat people with dignity. And, I've read stories. There was something out west a few months ago where a statement by a first responder was, let them die. That makes my skin cringe. But we are under a tremendous increase in volume with all calls, let alone overdoses. And, while we may not have it in our protocol and call it love, being non-judgmental and doing the job that we are there to do that is trusted to us is not only our job, but it's our privilege. So that's where the 911, that's where the first response is. When we get to a receiving facility is to make that contact. If it's with police officers, with Newcastle County, we can talk about hero help. We can introduce all those things in that short period of time. That's the problem with EMS, is that we have a short exposure. And when we let go of them and we get back on the next run, it's turned over to everyone here, so.
Christine, your thoughts on sustaining recovery?
Family support, family support, family support, and ongoing therapy. You have to talk to your kids. And Rebecca mentioned not being afraid to call 911. One of our girls, a 15-year-old girl, out with her friends at a party, and they did heroin for the first time, and one of the girls stopped breathing, and they called 911, and that is how they saved her life by doing that. So please, if anything, talk to your kids, and please know if you're in a situation like that, do not be afraid to call 911.
Thank you, Christine. Elizabeth.
Well, in addition to all these wonderful things that were already said, including wraparound support, is medication-assisted therapy. So allowing and being open to the idea that while you're rewiring your brain, that it's okay to have this medication-assisted therapy to help you slowly taper off so that you actually are able to be successful. That's where the evidence is showing great success, and then working with your therapist in order to change the dosage, but I think one of the most important thing is we don't talk about that enough.
It's time for our,
Actually, I want to say one thing. I want to
Yes.
piggyback what
Christine.
we actually do medication-assisted therapy at Nemours. So you can also do that for pediatrics as well.
super. You have been awesome. You've been so attentive and obviously engaged, and now it's your turn. So questions for a specific panelist, or you can throw it out in general, and someone will jump up. Gentleman on the right side, please give us your name and your question. Great question, and it's the stigma question, and it's a huge issue. Who would like to? Elizabeth, jump in.
I'll actually compare it to the way people view obesity. So if you think about the way folks view obese individuals who are also, it's a chronic condition, I think people think, oh, you can control that. You can control the way you eat. You can control those drugs that you're taking, not recognizing that there's certain things happening emotionally, there's certain genetic things that are occurring. So I think, again, recognizing and stop the blame and moving towards how can we help you get better. That's really important.
It's a disease, and all the science supports that. Michael.
I think a lot of people believe it's self-inflicted.
Yep.
And with that being said, that they don't realize that it's hereditary. You know, it's through your family genes, and it becomes an issue then.
I've had the good fortune of recently doing some research with Penn State Abington and all, and one of the projects we're working on is the connection between adoption and foster care and higher rates of addiction. And what's really, really encouraging is working with academics there. I'm in touch with some people at Stanford, where I went to school, and also at Villanova and Eastern University out on the main line of Philadelphia and all. The research is just indisputable. And when you have that research, the stigma has to be confronted and eliminated. Great, great question. Next question from our audience. Young lady about 3/4 of the way back. Yes. Name?
Thank you for saying young.
Yeah.
My name's Beth, and I am in long-term recovery.
Great,
And
Beth.
I agree with sustaining recovery with everything everybody said, but changing in behaviors and changing and accepting the responsibility and accountability. And with everything that everybody said, giving the person time to make those connections for themselves, that they have to do that. And it's not done in 7 days. It's not done in 6 months sometimes. Sometimes it's 2 years, 3 years before somebody can really make those changes. I just wanted to add that.
Yeah, you know what, Dominica, could you answer that question? Because I think what Beth is alluding to, that all of us in the recovery profession have to deal with, is, okay, you had your 28 days, you are C-U-R-E-D, cured and all. And can you talk about the need, as Beth described eloquently, the need for realistic expectations? Probably most of all, I think, sometimes for the family to have realistic expectations.
You know, they say that it takes double the time to unlearn any negative or positive behavior or habit, right? So think about that realistically. If someone's using for 4 years, we're talking about 8 years of in-depth psychotherapy and all the other things to get them back where we need them to be. So what happens, right, is we have, and more common than not, someone will stop using, and then they'll pick up some other behavior that's unhealthy, right? So they're not using anymore, but now they're gambling. Or they're not using anymore, but they pick up, you know, other high-risk behaviors. We'll just say that. You know, or you know, shoplifting. Just, you know, those things that all come along with you know, this disease, criminal behavior. I can't tell you how many people I know used forever, got sober, never got charges, and then got into like criminal behavior while they're sober, and everyone goes, why are you doing that now? Well, if you're not replacing it with positive things, changing your behaviors, then those same things that happen, you know, prior, you're just going to replace them with something else negative. It's kind of, you know, it's a frustrating part for all of us to see, because we sit back and go, no, do you know where this road's going to take you? You're sober now. But that's what people think. Well, now he's sober, And that's what individuals in recovery think. I'm sober now, so now everything's going to be, yeah, it's rainbows and sunshines and unicorn. I go into our treatment community, and Mike can attest to this, every week, and they call me Debbie Downer the one day I go in, because I say, just FYI, all those people that tell you how great your life's going to be now that you're sober, it's all a lie. You know, and then they laugh and we joke or whatever, but we talk to them about, you know, when you're using, you don't have to worry about if your bills are paid on time. You may not worry about if your kids are safe, clothed, taken care of. You may not worry about your spouse. All those things are going to hit you like a ton of bricks on the 29th day when you walk out of this facility and everybody goes, you're sober now, get it together, go find a job, pay your fines, do this, be a good dad. None of that is going to happen overnight. So it's really important for the families to get involved in a family program, regardless of where that is, Al-Anon, Nar-Anon, whatever, but also therapy themselves, and that they're having very realistic expectations of what that first year, I mean, like you talked about, you're starting to just now kind of get on the other side, right? That first 12 months is so difficult, you know, for anybody, and if people don't have the right support, unfortunately, you know, they say right now 6% of people leaving treatment after 28 days are staying sober for 18 months. I mean, and that's just opiates. So think about that. I mean, and then for alcoholism, you're at like 17%. I mean, those odds are terrifying, right? Again, it's like we're under attack, you know, so we have to have realistic expectations to wrap around people. Connection, 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 you know, compassion, compassion.
Yeah, and I think it's so unfortunate when the insurance dilemma comes up. And I can remember when I was first in rehab, my 28 days of rehab at Marworth, and there was a woman who had not done very well. And about 10 days in, she had a great morning. She was in a group, and we had 75 people in our group sometimes. And she did really well, and everybody was going up to her afterwards. And then when I went to lunch about an hour later, she was at the nurse's station crying because she had to get her stuff. Had to get her stuff to leave because the insurance had been taken away. And the thing that infuriates us, and I'm glad we talked about some of the solutions here, persistence most of all and all, but that a person somewhere in the middle of the Midwest can call a rehab, and they have a template there, and they ask, 12 questions, and they tell the people who are actually working with that patient, well, they're okay, they can leave now. And they order, it's not just they can leave, we're telling them to leave. And that's one of the public policy issues that we who care about this incredible tragedy need to work very hard on it all. A couple more questions, and we're gonna keep to schedule, so we have about 20 minutes more before we wrap everything up. But who else has a question? There we go, thank you.
Hi, my name is Jude Quinn. If you think this can't happen in your family, those 6 people that died a couple weekends ago, one of them was a member of my family.
I'm so sorry.
And
We're all so sorry.
she was in a shelter in Dover, and I know that, her mom, my cousin, was practicing tough love, trying, she and her husband are raising their grandson, which was my cousin's daughter's son. And now, what kind of resources are there for her? Because I know she's thinking to herself, if I had just done that one more thing, if I had just let her stay over that one night when I kicked her out because she said she wasn't using and she was, what is there for her and her husband and her grandson now?
Yeah, the grieving process is so difficult. Does anyone want to speak to how you can help?
So first of all, I'm very sorry to hear about your loss. And then the second part is for them, and especially for any family member, know that there is sort of your own self-forgiveness. So I think the most important part is go to the Help Us Here website, helpushere.de.org. Make sure, and they can call, if they want to call, our mobile crisis number is probably the best one. And at any point, we can have anyone begin to enter them into a system so that they can get counseling services that they need, access to anything that they need to help support them through this. And then on top of that, if they have someone who's under the age of 18, obviously we will help navigate them to the right treatment. But really, this is the time to not judge yourselves. And I think one of the most important thing, and I'm sure Dominica can talk about this, and I'm sure Becky has gone through this, and as a person who our family member has gone through this as well, is this sense of what have I done wrong? While not only something happened to your child or someone you loved, but at the same time, while you're going through it, what did I do wrong? And everyone's judging me because I'm a bad parent or I'm a bad spouse. That is not the case. And that, again, goes back to stigma. We have got to stop judging people for going through this. This is something that happens to any family member. It happens to anyone you love. It doesn't matter what you have done. But really, the most important part is forgive, and then going back to the compassion and love and continuing to not only love yourself, as well as continuing love to your loved ones. So I think, again, we're here to be a support to them and help get them into sort of the therapy and counseling, because that is traumatic. So we want to make sure that, again, they break that cycle of trauma and get them support now.
Don, I'd like to add something.
Yes, Rick.
First
Yes.
of all, I'm really sorry for your loss.
Absolutely.
That's just so tragic. I do want to make you aware of another resource in Delaware available on the Help Us Here website, and that is the grassroots organization Attack Addiction. They have chapters in all 3 counties. So please look at the website, attackaddiction.org. I also happen to sit on their board as well, and there's a lot of other people here that help support that organization. But we offer support groups at those meetings. The one here in Newcastle County is the second Tuesday of every month, and we have a regular support group and a grief support group, so that you and your family aren't alone. Know that there's people out there that can help you. Because you're not going to get over this. I don't even know that you'll ever even get through this, but we are there to help support you.
Yes,
Just add
please.
one other thing really quick. So there's a group called GRASP also that is beneficial. There is a woman, and her name is Lori, and if you catch me before I leave, I'll give you her information. She actually is a care advocate, and she works with people specifically through situations like this. She's in Delaware and Maryland. She's a great resource. There's a group of about 17 women, and they just do a phenomenal job, and they connect people to resources, same concept. And also, we have a family program that's free on the weekends, Saturdays and Sundays. I can give you a little more information, but anyone can come, and it helps in any of these scenarios. Same thing. And you mentioned a child, Delaware Guidance. I can't speak highly enough about the work, the trauma work that they do in situations like this, so that might be another resource for you as well.
Couple
I'm
more
very
questions
sorry for
from
your
this
loss.
great audience. Who else would like to? There we go. I see
Right
the
here.
mic being passed. Yes.
Okay. Sorry, I just wanted, because I'm standing up front, can't see everybody. So my name's Julie. I've been.
Hi, Julie.
Hi. I've been working with Dominica for a few years, and I wanted to make a couple of comments, and I do have a question as well. So for families, because I know people at high school, they're always wondering, what can we do? What is the solution-focused way? A couple of things to understand as far as the EMS is they've been using naloxone for 40 years. Delaware, we've only had access for community members for a couple of years now to actually have it in our homes and have access to that. If you don't have financial means to purchase it, there are ways that you can get the medication for free. And then also a number one thing that you have to understand, if you have a loved one that's in treatment, they're one of the highest risk of overdose when they come out of treatment. So even though that you think that they're in treatment, that they're going to be okay, they're going to be cured, I don't need naloxone, that's absolutely the time that you do need it, and you need to educate yourself and your family. I've also worked a lot of street outreach base, and I'm a parent of 9-year-old twins, and I think one of my biggest concerns that I have is, when is it appropriate to talk with my kids? During street outreach a few years ago, I even come across 2 10-year-olds shooting up heroin, okay? We actually made a map. Sorry, I get really emotional over
Take
that.
your time.
Yeah.
Take your time. You're
But,
fine.
you know, Delaware made the map a few years ago when they brought, when that child brought a whole bunch of dope bags to the daycare and was passing it out with their friends. So the thing that parents can do what's best is stay involved with your children's lives and be very proactive. I've been sober for 9 years now, and I've been sober the day my twins were born. But, sorry. And I think for me, my parents were never really that involved because there was a stigma still associated, and even today. And especially with when you go in and you think that you go to elementary school and your children are safe, you don't realize what the other children they interact with and what their homes are like. Even if they're like 5 years old, it's important to just go ahead and start talking to them about different ways to, combat like peer pressure. And that's why I think it's incredible for high schools to really work with the children to start with advocacy programs and have peer change leaders within their group. So my question though, is actually for Nemours, because you were talking about doing drug screening for children. Would parents have access to that drug screening?
No.
Right. Okay, that's a good question. Okay, all right, thank you, that's it.
Thank you for your thoughts. They're excellent ones. We'd like to take the last two questions from any of the young people who are here, because you're the generation which is changing so many other things around the country, policy-wise and attitude-wise. So we have some youngsters back there, not youngsters, but young adults and all. So introduce yourself and pose your question. Make a statement as well if you'd like.
So, hi, my name's Carly. I'm 17. I go to Newark Charter. So I guess I want to say thank you for spreading the idea of compassion. I lost my dad to addiction, and I was young, so I didn't understand at the time. Looking back, I wish that I had compassion for him, because going through it, I think that you're so angry because you feel less important than the substance. So I guess my question is, what are you doing for kids? Because I wish that I had someone telling me, be compassionate. So I guess I'm asking, can you do something for high school students? Is there something being done to spread the idea of compassion? Because I think it is so important for them to know that they're not by themselves.
Anyone want to jump in? Because first of all, we're so sorry for your loss, and your strength and courage in talking about it and your statement were both brilliant, and we appreciate that, Carly, very, very much and all. That's really courageous and all. So who would like to answer the question of how we're addressing this for our young people?
All those things are normal. The therapist in me has just got to say that to you. Like, all those things that you just said, all normal. Like, that anger and that resentment and all that stuff, all normal. I have 5 kids. Their dad is in active addiction, and we go through this in our household on a regular basis, exactly what you just said, that substance is more important, right? They think that on a regular basis, all normal. And I'm really sorry for your loss and that you had to go through that, but compassion is a great thing, and it's wonderful to treat addiction with, right? But at the end of the day, that person is still responsible for what they do, right? And no one says, when I grow up, I want to be a drug addict and overdose and die. That doesn't happen, right? But when you ask about what we're doing in Delaware, and I imagine you'll chime in, but so there are school nurses.
Two of them in the audience. Can you guys wave to us?
And
Thank you for what you're doing. They're awesome.
Our nurses in Delaware are so committed to our kids and to treatment and prevention. So RCA, I can name a list. Brandywine Counseling has prevention programs. They go into the schools, they go into the community, they do all kinds of programs. Connections has some, RCA has some. If you're interested in doing something at your school individually, get with Julie right there. We'll come up with a plan. We'll come into your school. We'll do whatever you want. And the best way to do that is to get other students involved and let us show you what you can do and just mentor you through it, right? And we offer those services anywhere. We'll go anywhere and help kids like you start prevention programs in your school. We'll mentor you through it. We'll do whatever. So they do exist. They are out there. And if you want to get with us before we leave, we can give you information on our programs and the other ones. I mean, we'll give you whatever we have.
Okay.
Everything that she said. It's great. But I mean, at Nemours, in particular for yourself, and I'm so sorry for your loss. And I think now, I don't know, how old are you? I'm 17. You're 17. So now is the time when things tragically happen like that. And I don't know when this happened, but I think as children, we tend to bury it, and it lays on our heart. So it starts to come out in anxiety and depression when you go to high school. Same like ninth grade, and you have the stress of keeping your grades up, and now you're thinking about college and all the other adolescent things that go on in your mind, but you also have this weighing heavy on your heart. And you said something very interesting, that like you feel like you wish you had the compassion at the time. So I think that's something that you shared, that's something that you may be struggling with. And when you ask what programs we have for kids, I think in particular, I'm thinking that you shared it with the audience, you shared it, and that you really need to process that. And there are so many programs here that everyone has talked about. Child guidance, there's Brandywine Counseling, what else is out there?
But go talk to your
And
school
all of
nurse,
those.
too. Your school nurse can connect you.
Your high school has, and many of your middle schools have behavioral health counselors.
Right. I mean, and even Nemours, you can come to Nemours to have counseling. But this is what I tell kids that have been through, teens that have been through traumatic events. Say it's like you get emotionally constipated. It's like you don't feel good. You have to process it. And once you process it, you'll begin to feel better. And I think that's probably the biggest advice I could give you, is to talk to someone that you connect with, that you feel good with talking to and sharing, and start processing your feelings.
Yes, go ahead, Elizabeth.
I just want to add too that I heard what you said. What are we doing about it? How can I do something better? One thing we are trying to do in the state is better identify when a parent has an addiction and make sure that we're looking at the family support. So maybe in the future, I'm hoping after we launch our centers of excellence, is that we'll actually be able to make sure that kids are not left in the same situation, which is you also need support as you're going through it, because it's not just you suffering with that addiction, it's the whole family. And so, like everyone said, those are all those normal feelings that we talked about, which is that sometimes you do the best you can, and that's what you were doing. You loved your dad as much as you could, and there you go. We want to make sure that we have better systems to identify when a child may be in that situation, so that we can make sure that they get counseling and therapy too. So we do want to do a better job with that.
How about a last question from another young leader before we wrap things up? Are there any other students out there who have a question or a concern? No. Well, let me, I'm sorry. Yes, sir. Yes. Absolutely. Going back to school. Yeah.
Hey, I'm Jim, and I'm in long-term recovery as well.
Congratulations.
Thank you. And I come from a long line of addicts or alcoholics, okay? You guys kind of touched on what I was going to ask, but how can we kind of break that chain of addiction, okay? Because I thought, just for me, I thought that I could smoke weed but not drink, you know what I mean? And then down the road, I found out that I couldn't do that because anything that I do to the tilt. So, like, how can we identify that? Like, change the stigma of, like, once you're an addict, you're always an addict. Like, my father was an addict. I'm an addict. My son's going to be an addict. His son's going to be an addict. You know what I mean? How can we change that? Like, educate. It's like how young is too young to educate children? Because somebody said 10. I mean, like, it's getting younger and younger and younger and younger, and like eventually, like, where does it stop? You know, for me, that's something that scares me, man. Like, I've turned my life around for the better, but the tidal wave of chaos that you leave, you know, and the way it affects your family, the people that are around you, it's a very traumatic experience, not only for me, but for everybody that is in the tidal wave, or per se. So, like, how do we combat that? Like, any ideas on?
That's a great question. It is a tsunami. It's a tsunami that overwhelms a family, you know. But it is the education of hope that we need to concentrate on. Who has some specific thoughts, and then we'll wrap it up.
I think as soon as your children understand, that is when you talk to them about it. And it's keeping those lines of communication open. I mean, you're in recovery. I wouldn't say you're an addict. I'd say you're in recovery. But have those conversations as, I mean, so I think like in 4th grade, I think kids, you could really start, depending on how mature they are, they would probably understand.
Rebecca?
Yeah, I was a cardiac nurse a long time ago, and we used to always talk to people about their cardiovascular risk factors. So if you knew your dad had a heart attack at a young age or had high blood pressure, whatever, what would you be doing as a young person to try to take care of yourself? You'd probably watch what you eat, maybe not smoke, and do things because you don't want to have a heart attack like your dad. And I think that's the thing that we don't talk to our young people about, is that you may, because genetics is 50% of it, we may not be saying to our kids that, hey, your uncle, your grandfather, this person, that person has the disease of addiction. And so if you take a substance and find out that it makes you feel differently, then you may need to seek help. And I think that's the part that we're not telling our kids. But we are trying to get into the schools and do some prevention education. Actually, a program that the state is looking at starts as early as 3rd grade. So we're hopeful that we'll be able to get more of that into the schools starting this fall.
I don't want to volunteer other people's time, but can all of you stay around for a couple of minutes if people want to see us? And I want to, yes? I want to thank you. I want to thank this awesome school and the Red Clay School District for facilitating this. I want to thank our panelists, remarkable people. I'd be remiss if I didn't say something about the first responders. The first responders are such a part of the solution here. And I have a number of friends who are Philly firefighters who work Kensington and the other neighborhoods I have my street ministry in. And sometimes the firehouses run out. They run out in Narcan. And they go and buy it out of their own pockets. So the dedication of the people that you all represent is enormous. And I just want to close on a note of hope. I often hear people say, you know, we have so many tragedies, we've all gone to too many funerals, and that's going to continue, but hopefully lessen in the near future. But I refuse to call them small victories, because any moment that involves an addicted human being being alive another day is a huge victory. And today I had one of those victories, and there was also, I want to mention briefly, I'll get right to you, Mike, but there was a public policy victory. And all of us need to help the attorney generals go after the pharmaceuticals. That's just my opinion, and need to have the pill mills and the phony clinics. As 60 Minutes showed, you know, the DEA was told to stop going after them by Congress, and the president signed a bill that was just, you know, well-intentioned but terrible. But today, before I close on the anecdotal huge victory of the day, the U.S. attorney, one of the U.S. attorneys in West Virginia, arrested 100 people. And between them, the 100 people they arrested in a state that is in a tragic, tragic situation, had enough fentanyl was seized that, according to the U.S. attorney, it could have killed 250,000 people. So we need those big law enforcement and other public policy victories. But I close with a note about a girl I met a month or so ago on the streets of Kensington. And Kensington, you know, is the epicenter and all. And we got her in a detox, and we didn't think that, you know, she would stay, but she did. And then we got her into rehab. And I went to see her today, and she's doing great. She's going to be discharged in another 3 days. As was mentioned earlier, she has a great aftercare program, structured, really, really structured, that'll be monitored so she doesn't just get released from inpatient and all. And she said 2 things. She talked to the group while I was there. I came in during a group meeting, and she said, "I'm sick of paying my drug dealer for killing me." I'm sick of pain. And there was great unanimity in the reaction of all the other addicts. And I was an alcoholic from the age of 16. I became addicted after a car accident to OxyContin and Percocets and all. And I never used drug dealers. I had prescriptions and all. But, you know, I was allowing myself to kill myself. And that's something we all have to acknowledge and battle against. And then she said something, and I'll close on this note. Her mother hadn't seen her. Mother hadn't seen her since we took her off the streets of Kensington and all. But her mother had seen her many, many times during her history of addiction. And she said to the group, she said, you know, yesterday was visiting day, and my mom came in, and she walked right by me. She walked right by me. And so I went over to her afterwards, and I said, Susan, that's a place you don't ever want to return to. And thanks to these people and you people, that doesn't have to happen. So I'll be around afterwards if you'd like me to be involved in anything, even though I'm in Philadelphia and Camden mostly. I'm glad to come to schools and community organizations. And my ministry also works in the tri-state area, including Delaware, with low-cost and no-cost interventions. We think that's important because some of them are grossly overpriced and all. So if you have questions for any of us or would like help, please see us afterwards. But God bless you all for being here, and please create the ripple effect that'll save lives by talking about what you learned tonight. And now, a super round of applause for the man who put this together, my dear friend Mike Carney. Michael?
Thank you. I just want to say briefly, leading up to this, the last couple of days and today, I was very nervous. I must say I was probably scared. And I have a whole different, I'm committed now. I really want to help. And I'm telling you, hands down, this group right here, I was blown away. You guys were awesome. We didn't get a chance to go over any of these questions. Don, you handled it great. The panel was awesome. I mean, I was sitting back here and I was saying, I was actually proud of myself because I said, you know, I did pretty good here. We did pretty good. And then more people than I thought were going to show up. The young lady and the Newark Charter kids were awesome. McCain High School and Brian, you were great. They had a lot of things to work out to get this up to Servium Academy. Servium Academy was watching this whole thing while we were going on tonight, and they were saying the picture was great. You could hear the voices as long as we talked into the mic. Sorry for Servium. So, and now Brian and I were just over there going, how many different ways can we make this better? You know, they were talking about get the school nurses here, get the coaches involved, get the guidance counselors and get the ball players involved, get the young ladies on the teams and the, I mean, you can just bring this thing, and you're right. What was your name from Newark Charter? Carly, yeah, Carly sent me an email earlier that they're coming, they're going to be here. So responsible, so great. These young people, they're going to make this thing a difference, and thank God for them, and hopefully they can get to the legislators. I was blown away. I am. I'm speechless. I'm not speechless, but, or I wouldn't be talking. Thank you all so much. We do appreciate it. Human Ecology Foundation is going to back this up and keep on running with it. It was a great group here tonight, and I thank you all.